tear and repair. So typically, the most damaged muscle is supraspinatus because it's coming right up underneath here. After that, I would say infra, and then it's anybody's guess depending on what the person is doing for a living, basically.
Mm-hmm.
So we got a tear, they come in and actually sew it together. Sometimes it's not straight sutures, sometimes they actually staple it back to the bone. It depends on the quality of the tissue. Sometimes they'll trim part of the acromion process or shave it off underneath to get rid of those spurs. Fortunately, we don't have to do that surgery, do we? We just have to fix them afterwards. Okay. So rotator cuff tendonitis might result from excessive overhead, like serving if it's tennis, where the humerus is held at a 90-degree angle to the scapula. So it's like, basically, if you're gonna be doing work overhead, you're better off to be up a little higher than right here. Is what this is saying. This would be the humerus at 90. This would be the humerus at 135. This is going to rotate out of the way to allow this better flow. This is just jamming right in there at 90. So if I'm just doing my shoulder at 90, what I'm having to do is jam that directly in to the. So at 90. To do this, I've got to jam that right in there. Whereas if I'm up a little higher, when you get that hit, it's just going to glide down a little bit. So it's not as likely to do damage to that tendon. If I'm hitting, it's going to kind of glide down a little bit. Here, I'm going to jam right into that.
Do you also have some more strength up there when you're doing things like that? It feels like
Yes. You're using different muscles at this point, and you're putting your. Basically, what you're doing is you're putting your arm in a position to not impinge that. So part of this discussion is really about thinking about when you're working with patients is like, okay, is it okay for them to go back to sort of trying to do what they used to do at an impaired position? Maybe yes, maybe no. You know, maybe limited. You know, I've got a friend right now that's recovering from rotator cuff surgery. She wants to play tennis, and so she's getting back to playing tennis, but carefully. So she's not serving yet because she doesn't have the range of motion for that. She's just doing some light volleying. Okay, so maybe you start back with something before you go full out. Okay. Reversal of muscle action. So what this is about, we've kind of broached this before. Insertion, typically speaking, the insertion moves towards the origin. So the origin is the stable part, the insertion is the movable part. So the insertion moves towards the origin. Reversal of muscle action occurs when the more movable end becomes less movable. So like a chin-up, the humerus moves towards the forearm. So if I'm doing a chin-up, so instead of doing this, I'm doing this. Okay, so I'm just going the other way. So the origin moves towards the insertion.